Hello there. In this video, I'm going to go over the repair of prior hair transplants. Worldwide, there's over 700,000 hair transplants that are performed each year. So it's not surprising to find out that a small number of these hair transplant results are suboptimal and can be improved. Now, there's a number of reasons why hair transplants results are unsatisfactory, and they include things such as poor planning and design, poor surgical technique, using grafts that are from outside of the safe zone, the improper placement or angle of the grafts, trying to cover an area that's much larger than realistic given the number of donor hairs available, and putting too low of a density in areas that require much higher density to achieve the desired effect. Additionally, performing hair transplants on those individuals who are poor candidates for surgical hair restoration, or performing hair transplants on those individuals who have underlying medical conditions that negatively affect the growth of hair, and those individuals who do not follow the post-operative aftercare instruction that's prescribed are all factors that can contribute to poor hair transplant results. From our experience, the majority of people who come to us seeking to have a hair transplant repaired do so because they're unhappy with the density. The next most or second most common request is to have an unnatural hairline repaired. Hairlines can appear unnatural for a number of reasons, including improper height placement, meaning that the hairline was placed too high or too low. Another reason could be an unnatural shape to the hairline, being too straight or linear or too curved. Using grafts that are incorrect in the hairline also can give a natural appearance. For example, hairline should only have single hair grafts placed in the hairline. However, if a graft containing more than one hair is placed in the hairline, it can give it a stalky or pluggy appearance. Also, putting the grafts in an incorrect angle or using too low of a density can contribute to an unnatural look. So the repair solution depends upon the nature of the problem that needs to be corrected. For example, if the issue is that the grafts had been placed at an incorrect angle, these incorrectly placed grafts need to be removed. And this can be done using the FUE technique, in which a dermal punch is used to remove these incorrectly placed grafts one by one. The benefit of using this technique is that the grafts can be reused and not wasted by repositioning them at the correct angle during the repair process. The disadvantage of this technique include incomplete removal of the graft can lead it to regrow at the incorrect angle again. Also, you can lose the grafts by transecting or cutting through vital aspects that the follicle needs to grow. Also, because you're using a dermal punch to cut through the skin to remove these grafts, there can be increased scarring in the area. Sometimes the hair follicles need to be removed by other means, such as laser hair removal or electrolysis, and each of these modalities have their own sets of pros and cons. In this example that you're going to see next is a guy who comes in because he was unhappy with the density of his hair transplant that was performed in an outside clinic. As you can see in these photos, the density of his transplanted region is very sparse, with a lot of see-through and scalp showing. In order for a hair transplant to work, there needs to be sufficient density, especially in the hairline, to give the appearance of a fuller, thicker head of hair. The hairline needs to be at a height that looks natural and that will age well with the person. Additionally, there needs to be a gentle transition from the hairline to the hair behind it. For his repair, I did not alter the hairline height as it was in a good position. So for him, the corrective solution was to increase the density by adding more grafts to the hairline and frontal band by working carefully in between the previously transplanted grafts. It should be mentioned that sufficient donor hairs are required in order to do a corrective hair transplant procedure. Here he is 8 months after the repair, and as you can see, his hairline looks more natural with a much thicker and fuller density. I started the dense pack corrective hairline a few millimeters above where the previous hairline began, and this helped to create this very gentle and natural looking transition to the hairline and frontal band behind it. As you can see, this approach also helped to make the transplant look more natural and gave him the appearance of a fuller, thicker head of hair. Here are some before and after images side by side so you can really appreciate the improvement after the procedure. Compared to the before pictures, you can see that his hairline now looks much more natural and the density of the frontal band is much fuller and thicker. The success of a hair transplant relies heavily not only on the density of the hairline, but also its placement and shape, which will give it a natural appearance. His hairline is at a height that is age appropriate, it looks good on him, and it complements his facial features. A crucial factor in achieving a natural looking hairline is to ensure that it has a smooth transition to the hair behind it. At our clinic, we always use a dense pack in the hairline and frontal band to achieve a natural look and fuller head of hair. This corrective procedure we did for him has given him a new lease on life, boosting his self-confidence and restoring his self-esteem. If you had a hair transplant and you're not happy with the results, know that it can be repaired in most cases. Feel free to contact our clinic for consultation to explore your options. And as always, thanks for watching the video. I hope you enjoyed the content, and please stay tuned for more videos in the future.